What a powerful way to begin today. Thank you again, Shaila and Ali, for that incredibly grounding conversation. It reminded us that while climate and health challenges can feel daunting, the path forward is one where we build together through cross-sector collaboration, shared leadership, and a commitment to equity. Good afternoon, everyone. My name is Shania Taylor, and I am the Acting Director of Programs at the National Academy of Medicine, where I have the privilege of supporting programs that center community expertise and scientific leadership in climate health and beyond. And I have to say, it feels especially meaningful to be back here at the New York Academy of Medicine, an institution that I once called home. NIAM is where I first deepened my commitment to honoring the work of caregivers, communities, and those most impacted by the systems we seek to change. So as we shift now from big picture reflections to on the ground strategies, our next session will focus on something that continues to challenge us all: how to strengthen climate and health research through shared priorities and the smart use of limited resources. To guide us through this conversation, we are incredibly fortunate to have Dr. Mary Meyer, a physician, public health leader, and emergency medicine expert who brings a uniquely grounded perspective to this moment. Let's welcome Dr. Mary Meyer.
Tape on the microphone might be a bad sign. Am I on now? All right, excellent. All right, good afternoon, everyone. Thank you for being here. As you just heard, I'll be moderating our first panel today, and I am actually very excited to be moderating this panel because we're going to be discussing a topic that is near and dear to my heart as both a frontline physician and as somebody who co-leads a program in environment and health. So we're going to be talking about research and specifically what we can do to both strengthen and extend our existing knowledge, and then how we can also collaborate across disciplines, understanding that this is an era in which resources appear increasingly constrained. So we're going to start out by hearing from each of our esteemed panelists. They're each going to speak a little bit to their work, and then we'll have about 20, 25 minutes at the end for a Q&A session. And my hope is that by the end of this panel, all of you will have picked up some tools that you can then take home and use in your own practices and your own work. So with no further ado, I'm going to give you a brief introduction on this very impressive group of panelists. Our first panelist today is Dr. Renee Salas. She is an emergency medicine physician and the founding director of the Cooperative at Mass General Brigham. She is also lead for the Lancet Countdown U.S. Working Group, and she's going to kick off our panel today by discussing the National Academy of Medicine research agenda to protect health in a changing environment. Our second panelist is Dr. Ying Go. She is a pediatrician, and she has extensive experience in the private and public health sectors. She is a former public health director for the city of Pasadena and also a former senior policy advisor for Vice President Kamala Harris. As our second panelist today, she'll be describing her work with the next generation of leaders in climate research. Our third speaker today is Mr. Jonathan Gilmore. He is a co-founder and vice president of the Impact Project, which is an initiative to make data more transparent and accessible. He's also a visiting data scientist at the Harvard School of Public Health. And we're going to be hearing him present his fascinating work preserving data in the face of many efforts that now exist to erase that data. And our fourth speaker is Dr. Teddy Potter. She is a nurse and a PhD. She is also the director of planetary health at the Center for Planetary Health and Environmental Justice at the University of Minnesota School of Nursing. And she serves on the National Academy of Medicine's collaborative on decarbonizing the health sector. She is going to round out our discussion today by discussing how we can successfully communicate information about climate change and health. Dr. Salas.
Well, thank you so much. First off, I want to thank the National Academy of Medicine, Kaiser, and the New York Academy of Medicine for this wonderful event. And thank you for the great fireside chat that led us into this and really helped set the stage. So I have the honor of presenting on the research agenda. Now, this is a tool that will, yes, it isn't there. Yeah. Do the slides show up on the front? Okay, they will. No worries. If not, we're good, but perfect. Thank you so much. And so really this is a tool that we want everyone to be able to use. And so I will be rooting this in some of the work that we're thinking about, and also really want to try to connect it because each of you hold a piece to this larger puzzle as we think about a path forward. So with the cooperative, as was mentioned, we are seeking to transform patient care and healthcare delivery to build patient resilience. And with the Lancet Countdown, we're seeking to really explore how can we step in and fill some of these data gaps at the nexus of climate and health to really make sure that health can remain centered in climate action. Now, there's a book that some of you may be well aware of, but it is called A Paradise Built in Hell: The Extraordinary Communities That Arise in Disaster. And if you haven't read it, I recommend it. But just the take home is that in times of crisis, people rise and meet the moment in profound ways and actually do it with joy. And I'm just seeing people come together in unprecedented ways. And so I want to root all of this discussion in that. And so despite all the challenges that we're facing, I really do believe that we can unleash radical collaboration to power data-driven solutions for real-world impact. And I think, again, everyone has a piece in that puzzle. So as we think about real-world problems, every one of you encounters different aspects of real-world problems. Now, in November of 2024, the Pew Research Center poll showed that only half of some US groups believe that science and scientists were focused on solving real-world problems, meaning half do not. So herein lies an opportunity for a path forward, because we all see and experience these problems from different perspectives. You know, you think about, you have your hand on the elephant and you all are sort of seeing different pieces of it, but it's all the same elephant and it's all connected. And so for me, for example, right, I see a patient that presents with asthma attack. We have wildfire smoke that has drifted down from Canada. So I'm seeing this end result, but that young girl came from her house where she maybe had windows where the air was coming in. And so any cooling that they had was not actually kept in there. And the bad air quality was actually, there was no home weatherization with which to retain that. They did not have access to an air filtration system. But then you move upstream to that other piece of where's the funding to try to bolster that? Where are those policy incentives? Should health insurance companies cover these interventions? What are the return on investments? Right? These are all questions that you'll see are represented in this agenda, but they're not, and they may appear in separate lines on a table, but they are all interconnected as we think about these threads that we have to connect together in order to tackle these complex problems. So the research agenda. So it was conceptualized due to the need to advance understanding, guide policy and practice, and to protect and improve human health. Because they recognized, crucially, that we have to identify and fill these research gaps to better understand the complex interactions in these complex systems with complex interconnected solutions between climate factors and health outcomes. And so the development of the research agenda included a multi-phase process to ensure inclusivity and comprehensiveness. And so I'll walk through that, but it was discovery and literature search. And again, I'll dive into what that process was. And you'll see that the research agenda really covers a multitude of topics related to the intersection of environmental factors, climate change, and human health. So this 5-phase process looked like the following. So phase 1, they conducted 20 interviews with climate experts to gather the insights and perspectives to really begin to craft the architecture of this research agenda, identifying what are these gaps. Second, they synthesized this and complemented it with a robust literature search. The third phase was convening to create a platform for additional discourse to dive into these research gaps and help to expand and add that depth and breadth to them. The fourth phase was that collaborative building of the research agenda draft, really focusing again on the crucial intersection between climate change, health, and equity. And then the fifth phase is a web portal that is going to be accessible to all. And this portal contains different resources that reflect and amplify the identified research gaps within the field. So these are the 4 overarching domains. So it's the climate impacts on health and that related economic outcomes, which I know for so many, that is a mantra that I've heard beat a drum that has been beat again and again this week in discussions. The second is the cross-cutting strategies to support climate health resilience and infrastructure. Again, adaptation, mitigation, and equity. These are not siloed things. They are all interconnected. Research and technology infrastructure and capacity building. And then, of course, policy and public communication, education, and engagement. So as we really dive into kind of some of the particular ones, and I know it may look like a dense document, but this really is a toolkit. So I want you to kind of pull up that document and dive into the table. They have list different areas kind of within each of these that you'll see represented here. And there really is a depth and breadth to these. So again, ranging from extreme weather events and food security and sort of those resulting health and economic impacts, again, to these, the cross-cutting strategies for adaptation for community resilience and vulnerable populations and health equity, and implementation science, which is so critical as we think about how we can quickly mobilize these solutions, and of course, interdisciplinary research. And then for the other categories, there's the research and technology infrastructure, looking at data gaps, harnessing new technology, to policy and public communication, education, and engagement, recognizing these are bidirectional processes and again, all interconnected. So this toolkit that the National Academy of Medicine with the support of Kaiser Permanente has created is a go-to resource for you as you think about, okay, how am I going to lean in and what part of the elephant am I touching? But I think more importantly, how do we actually bring that entire infrastructure together? So I was tasked with a personal call to action, which I appreciate from the Grand Challenge team. And this is it, that I think we can use this in addition to everything that you're going to hear here and have hopefully heard kind of throughout the entire week, to unleash this radical collaboration to power these data-driven solutions for that real-world impact that people have to see. They have to see the science is changing their lives and actually see those connections. So I think there are three things I want to highlight among that. The first is that we have to build out that entire system, understand the full elephant, right, at the start of it, because we have to think about what these short-term fixes are, but also know how is that connecting to the long-term system change that we have to have. So what are those practice, public engagement, policy, and finance levers that we have to act on? And then again, thinking about all those different silos, or non-siloed, but looks like siloed kind of within the table, but how do we actually connect those threads? The second is, recognizing that we have to have a broad table to bring all of that expertise together at that time. So that means that interdisciplinary expertise within academia. It means actually having that multi-sector collaboration sitting at the table. And of course, bringing the communities that people impacted themselves at the table from the start. So this work is community-centered. And then third is recognizing we have to have more of these coordination roles. So those backbones with which to actually facilitate this. We can all do that individually. We can reach out to people and start to build that connective tissue locally with other policymakers and communities kind of within our area of expertise and spheres. But we really need to try to eliminate that barrier. Everyone is very busy. There are less resources and less time and more problems right now for us to lean into. So we need to make it easy and have these structures, like what the National Academy of Medicine is doing on a variety of challenges, to bring everyone to the table and make it easy to facilitate that connective tissue in those conversations. So again, going back to, let's think about the 4-year-old girl who shows up in the emergency department with that wildfire induced asthma attack. So as we think about who do we need at the table, right? I'm seeing those end results, but we need to understand, okay, what are those economic impacts? So bringing that health economist to the table. What is that? Bringing that health insurer, like what type of stakeholder data do you need to really think about return on investment to start to fund some of these interventions that are preventative and traditionally have been viewed outside of the toolbox of the healthcare sector, like air filtration systems or home weatherization. And then what are the policy levers we need to make sure we have the funding needed to drive that? So in the end, I do think that we can, in this, build a collaborative, radical collaboration environment in this current moment. And I look forward to doing this, and each of you have a piece of that. So with that, I'll turn it to my colleague. Thank you.
Okay. Thank you, Renee. In my family, we experienced some of the that end result this summer with my daughter having 6 weeks of cough after a wildfire. So with that, I have the pleasure of speaking to you today as co-chair of an exciting initiative to explore climate change and health with the next generation of research leaders. And this joint policy initiative was a partnership between the Academy of Medical Sciences of the UK, whose mission is to improve the health of people everywhere by creating an open and progressive research sector, and the National Academy of Medicine. And they convened a group of 16 interdisciplinary health research leaders and policy leaders from their leadership networks. We're based in different countries, the UK, the US, and Hong Kong. And we had about a year and a half to work together starting in March of 2024. This activity was a part of a commitment that both academies had made in July of 2022 on action on climate change and health. And that component was to really invest and engage in early career researchers and policy leaders on climate change, noting that young people are essential to the success of communication, mitigation, and adaptation strategies. The project goals were threefold: to build a multinational professional network among a group of next generation health research leaders, also to provide career development through a group project to increase everyone's exposure to issues relating to climate and health, and to increase their experience making science-based policy recommendations. And third, to really co-create an end product that was public-facing, related to a topic of the group's choice, that was policy-focused. So these are the participants. A big shout out to my co-chair, Dr. Julia Wilson from the UK, who is the Director of Strategy, Partnerships, and Innovation at Wellcome Sanger. You can see that we have wide representation of a wide range of different types of researchers from different institutions, both in the UK and in the US. And my personal observations of the group was really that they were high energy. They brought so much openness to exploring this topic with one another and to learn from one another. And many of them expressed an explicit interest in using scientific evidence to make policy recommendations. So they were really interested in learning how to do that. This is a great looking group. This is our group. We are posing here at the Albert Einstein Memorial, which is on the grounds of the National Academy of Sciences, Engineering, and Medicine in December in DC. So we're bundled up. So how do we conduct our work? We had in-person convenings in London in May and Washington, DC in December of 2024, and that enabled us to do some formal work together. We really benefited from being in person because our first task was to brainstorm and negotiate what topic we were going to focus on within the broad issue of climate change and health. And we came to the consensus of looking at policy recommendations to minimize harmful environmental impact of health research. We also had the opportunity to spend some time together to get to know one another. This is part of the networking and community building. And I'll show you some pictures, but we did a tour of the US Capitol in order to expose everyone to the policymaking process in the United States. And we had a LabX social event, which was kind of scientific TED Talks mixed with food, drink, and music, which was lovely. We also conducted subject matter expert interviews. We spoke with US and UK climate and health researchers, funders, and regulators. And through these interviews, really learned about some of the leading actions that are happening in the UK by public and private researchers and funders who are incorporating sustainability as part of the funding process, the application process. So we benefited from that. And then, of course, over a year and a half, using virtual collaboration in full group, subgroup meetings, working across continents and time zones, conducting evidence reviews, interviews, writing and editing, and then really benefiting from everyone's personal experience, whether that was in trying to incorporate sustainable practices in their own research or in other experiencing the impacts of climate from a public health approach. So it's my honor to announce that as of today, officially, our report is available for the public. The title is For People for Planet, and it is a landscape review and set of policy recommendations with the aim to improve the environmental sustainability of health research in the UK and the US and globally. That can be accessed on the Academy of Medical Sciences website, and we are distributing by email as well. Our work indicated to us that health research has a significant impact on the environment, and that more sustainable practices across all different types of health research can contribute to meeting the needs of both people and planet. We identified these themes that we wanted to highlight in our report: data, funding, regulation, procurement, infrastructure, and capacity building. And all of this work culminated in 4 points in a call to action. First, to adopt and refine shared metrics, tools, and methodologies for all research activities, including digital and AI, we'll hear more about later today, to ensure transparent, comparable reporting, to embed sustainability requirements incrementally in funding, regulatory, and publication processes, pairing them with access to guidance and financial support. To invest in people and infrastructure, prioritize training, accreditation schemes, and green facilities that can be scaled up, and to foster international collaboration and data sharing, recognizing that climate change knows no borders and that solutions developed in one context can benefit many. So there's a lot more that I would love to share with you. I really encourage you to access this report if you're interested, because there's a lot that our really amazing group had to say. So I want to share some reflections about this experience. Allison, who's here today, thank you for saying that it's useful to think about how to minimize the environmental impact of one's own research cumulatively with other researchers, that it could really have a broad impact. Jenny said that the most powerful aspect was spending time with such a varied group. There are different perspectives that she will continue to draw into the work that she's doing in the future, and that doing this on a UK-US level was really useful in the global health context. And finally, Amy felt that co-creating a report was also a great learning opportunity, particularly the process of distilling complex material into policy-focused insights that could be both practical and actionable. So I will wrap up with a quote from my co-chair, but I also want to share that there have been some collaborations, professional collaborations that have come out of this group with one of my colleagues. We wrote a letter to Lancet. I live in an area that was affected by the Los Angeles wildfires, and we talked about this, really the need to make a sustainable healthcare system as we saw the impacts of those wildfires. And also that Julia and Jenny had created an educational workshop for PhD students. Also these partnerships that came about because of this group. So Julie's inspiring words: we can develop strategies that improve health outcomes yet minimize harm to the planet. And we had a fun run in Roosevelt Island in DC, and this was the evening of science and fun at the National Academy of Sciences. A special thank you to the president of the Academy of Medical Sciences, Professor Andrew Morris, and Dr. Zhao, the National Academy of Medicine president. Thanks so much.
Hi, everybody. It's an honor to be here. My name is Jonathan Gilmore. I'm a data scientist. I've sort of built a weird career in crisis response data projects. Today, I'm wearing two hats. They're invisible, but it's with the Public Environmental Data Partners and the Impact Project. And I'm really thrilled to get to share our work with you all. So the Public Environmental Data Partners is a coalition of groups working to preserve and improve public environmental data in a time of erasure. We got together in November of last year, right after the election, a coalition of nonprofits and academics and volunteers and people concerned about upcoming erasures of environmental and health and climate information. We knew that this was going to happen. It was evident during the first Trump administration and also laid out in plans like Project 2025. So I want to take a step back and talk about public federal data resources. So there are three main categories we're talking about. data sets like the National Health and Nutrition Examination Survey from CDC, databases like the National Inpatient Sample from HHS, and data tools like EPA's EJ Screen. And all of these categories are threatened. So over the past 9 months, we've seen access to federal environmental information and data and tools and web pages rapidly stripped away. We've seen over 110,000 government pages go dark. Equity and climate tools have been removed, like EPA's EJ Screen, CEQ's Climate and Economic Justice Screening Tool, the CDC's Environmental Justice Index, FEMA's Future Risk Index, et cetera. And most concerningly, moving forward, the work that goes into data collection and maintenance is profoundly threatened as staff is cut across agencies, staff's placed on leave, or just told outright to stop their work. So we at the Public Environmental Data Partners have 3 main pillars. We're working to preserve critical data and tools. So we're working with agencies, especially over the transition period. We're working with researchers and others who interface with this data and these tools to identify the most at-risk data and tools. Then we're working to archive them. And finally, we're ensuring that public access remains. So American taxpayers paid for this data and these tools, and we all benefit from them, and we all deserve to retain access to them. We're also working to build tools for the future. So we're working to discover how to better present information. We have a lot of folks who built these tools in government who are working with us to improve upon them. And there were 9 federal environmental justice screening tools. How can we integrate functionality and build better tools that better serve communities? We're also integrating state and local and community and NGO data sets. So we operate with the principle of nothing about us without us. And we're working to build interoperable, accessible, and justice-centered environmental tools. And then our third pillar is advocating for better data policy. So we're working to engage with cross-sector stewards of environmental data. We're working in policy and funding capacity and legislative changes. And then we're working to design and advocate for data policies to create a more accessible and resilient federal data infrastructure going forward. We know that even prior to 2025, we weren't where we wanted to be with our federal data infrastructure, and there are lots of improvements we could make. So to date, we have preserved over 300 data sets that were identified to us as priority. We've restored key environmental justice screening tools. So on January 22nd of this year, the Trump administration removed access to CEQ's Climate and Economic Justice Screening Tool. We put up an exact clone 2 days later. We've put up EPA's EJ Screen, EPA's EJAM, FEMA's Future Risk Index, DOE's Local Investments Map, ensuring that the tools that communities and academics and foundations used to direct investments and conduct research and identify areas where people are most at risk remain online, and then working to improve upon those tools. We're also doing a lot of coordination across the sector. So there are lots of organizations that are doing data preservation work, and we want to make sure that we're not duplicating efforts. And then we're doing public engagement and outreach, and we're speaking to the importance of this data and these tools and how it informs how we understand the world and how we understand how the environment and climate are affecting our health. Now I want to turn to the Impact Project. So this is a project to try to visualize and communicate impacts of federal policy changes and terminations and firings and agency reorganization, and really humanize that data and communicate the ways in which these changes are affecting communities across the United States and the world. This project was started by Abby Andre, who's our executive director and founder, in February to communicate how the changes coming out of Washington are affecting communities across the US and the world, and not just DC. So what do we capture at the Impact Project? We're working to contextualize this data with a pre-2025 baseline. We collect federal data, environmental data, socioeconomic data, and then we're collecting instances of government change. So actions that are leading to changes in communities. What agencies took those actions? How much was impacted if this is a grant or a lease or a contract termination? Who is impacted? And what are the indirect impacts of these actions? To date, we've collected over 125,000 instances of government change and hundreds of thousands of baseline data points. And a lot of our baseline data, we're trying to get as granular as possible. So at the zip code level or the county level or the state level, to communicate what the ways in which government worked and affected our lives pre-2025 and the ways that that's changed. We have hand-coded over 50,000 newspaper articles that are communicating ways in which we've seen changes affecting our communities. We've collected over 1,300 surveys from directly impacted individuals, especially terminated federal workers. We've created over 60 dashboards, so at the state levels and agency and programmatic levels, in order to add additional context beyond the maps. I like to say I'm part of the anti-map map club. Maps are amazing, but they also distort data. And so we want to make sure that we are presenting multiple ways of understanding the data. To date, we've released 4 maps: one general map, a public health focused map, an AmeriCorps focused map, and an agency budget and offices map. And we worked to partner with other organizations to make sure that we're pulling in the best available data and working with others who are seeking to communicate the ways in which we're seeing really profound changes in the way that government works. So this week at Climate Week New York, we demoed our climate and energy tools. So this is a project we're working on and we'll be releasing in the next few weeks. And we're pulling in environmental data. So on the left there, you have projected extreme heat days, data from Probable Futures, which is an initiative that spun out of Woodwell Climate Research Center. We have programmatic data, so IRA funding cuts by congressional district and state, and then socioeconomic data. And what we're trying to do with this map is overlay a bunch of different data layers to communicate ways in which our communities are being affected by changes to climate and energy and health policies. And we're particularly highlighting the Low-Income Home Energy Assistance Program, LIHEAP, and the ways in which that critical assistance for people who had trouble paying their utility bills is so important, especially in the face of climate change. We're seeing rising extreme heat. One of the other layers we're pulling in here is CDC's HHI data, which shows the increase in extreme heat days at the zip code level. And we see this burden across the United States. And we're communicating that we had created policies to try to alleviate burdens of extreme heat, of climate change, of rising utility bills. And many of those have been targeted. And we're hopeful that these tools can help us understand the changes we've seen this year and also move forward and address some of the harms and the gaps we're seeing. So we want to communicate the scope and scale of change and assess cumulative impacts from the different changes we're seeing. We also want to identify community needs. And so there are many communities that have been hard hit across a variety of sectors. We're hoping that these tools allow foundations and impact investors to identify gaps and work to fill them. Allow partnerships for NGOs and other organizations that are working to alleviate harms. And then bring to light policy opportunities to try to address some of the harms that we're seeing. So thank you very much for having me here.
Thank you very much to the sponsors and hosts of this event, and I am just wowed by my colleagues. Thank you for the work in the world. And I'm going to be talking about how we use the data you're preserving. There's an advantage to going last and an advantage to being old, and I am going to break the rules and stand up. And the reason I'm doing that is I can't see the people in the back of the room. And this is a message for all of us. Oh, I'm getting some people waving. Hello. But there's also people online. So I want to make it very, very certain that the people online know that even though you're not here in this room, you are in the room. And your work is very important. And we look forward to joining hands and working collaboratively on this whole effort. So it's my pleasure to talk to you about a program that I'm really, really excited about, and that's the Climate and Health Information Gateway. All of you are trusted voices. Now, if you're not quite sure what that means, I'm going to unpack it for you with some science. Every year, the Gallup poll since 1999 ranks 23 of professions in the United States. So out of those 23, the top 5, 3 of us have made it. Pharmacists, nurses, and physicians in the top 5 most trusted professions. I think that's something very proud to be, very good to be proud about. And because I'm a nurse, I just want to say it's our 23rd year in a row as number 1. And I am so committed to ethics that I brought my own copy of the Code of Ethics for Nurses. This guides our practice. So you heard do no harm, the Hippocratic Oath, non-maleficence. Beneficence is another ethic that we are really bound to and uphold in the health professions. We are deeply, deeply committed to science. So from our Code of Nursing, our profession is based on the foundation of science. You take science away, you take data away, and we cannot practice in order to protect your children and the elders in your family. We cannot do it. So I want to do a shout out to the NASEM report recently released on human-caused climate change and the health impacts. This is responsible healthcare. This is what the public demands of us. And more recently, I'm very happy to say that the Code of Nurses has added planetary health and environmental health into our ethical requirements of practicing our profession. So we're on the move. And are we practicing? Are we using this? So I want to call your attention to a study that was done in Minnesota, my home state, by the Minnesota Department of Health, School of Nursing at the university, and the School of Medicine, because we wanted to know if health professionals are talking about this. Clearly, we understand that this is a risk factor. And we also understand that we need to be moving on this quickly. And are we doing that? We surveyed over 4,000 licensed and practicing health professionals in our state. 75% agree that climate change is happening now. 60% are already seeing signs in their patient. This isn't something happening decades from now. It is happening right now, and you've heard my colleagues mention that. 58% feel that health professionals need to play an active role, and 4% are talking to their patients about climate change. So why? We sort of thought ahead of the time, oh, it's going to be a lack of time. But actually, it ended up being lack of knowledge. Now, they kind of threw patients under the bus. It was the patients aren't knowledgeable enough, but they said they don't have the knowledge of how to be talking with their patients. Lack of time came in second, and that the patients are not knowledgeable enough for us to have conversations with them was number 3rd. So when NAM asked me to co-chair this approach on bringing this information to the people and to health professionals, I jumped at the chance. Our charge was to summarize in plain language the impacts of climate change on health at the individual level, as well as the benefits of climate change interventions, and to support health professionals and other communicators in sharing this information in a sensitive, inclusive, and actionable manner. I had the A team. My co-chair is Joanne Calderon, but then we drew upon all this rich expertise around the country. Some were communications experts, some are health experts, some are climate science experts. And we all got in the room and started to say, how do we meet this charge? And it became very clear very quickly that we did not need another NASEM report. We needed to know how to access the information. I'm so glad you're preserving it. How to access the information and help people to understand where do we get good, solid information that's not fraught with misinformation and disinformation, which is really plaguing the entire system right now. So we had a great team and we started to say, what are the documents? What are the things that we all use? And it was fascinating because expert number one said, oh, I couldn't get by if I didn't have access to these things. Expert two said, I couldn't get by if I didn't have these. Expert three said, oh, my goodness, this is what I use. And there was not overlap. And the experts didn't know about the resources of the other people. So we decided that we needed to form a information gateway. And it's called the Climate and Health Information Gateway that allows people to tailor the resources that they're given based on their need and their profession. So I'm going to show you how we use this tool. But who is this for? Health professionals, researchers, primary care providers, public health departments, teachers, health professional educators, and essentially everyone. I want everyone to be using this tool and going to the source where they can pick up information vetted by the academies. They're not going to turn to, Uncle Joe and ask them how to deal with heat. They're going to go to the academies to get the best information. So this is what the site looks like. I kind of did a little trial run here. That you're asked a question, what's your primary role? And in this one, it's a tiny little print for you, and it was a tiny little print for me as well as I look at it. But it was, I want to serve somebody in my family who has health concerns. What are you interested in? We really want to know about air quality because it's terrible right now. And what actions do you want to take? I want to preserve the health of my family members. And they answer those questions and up pops the resources. And it's a variety of resources. It's videos, it's reports if they really want to go in depth. It's teaching opportunities, it's fact sheets, FAQs. We have collated over 300 resources, and that's just the beginning. We plan on continuing to add as resources become available. Here's another example. The question was, what's your role? And I said, health professional. What do you want to do? Join a health network or action group. And up pop all my options for doing that. Here's a third example. I don't know, I just logged on the site. My care provider told me about it, and I'm not even sure where to begin. My child is having terrible time breathing with a very poor air quality. And so I'm concerned about children, and I'm concerned about their mental health because the world that we're leaving them is not looking very good. So I'll just put children in the search engine and up pops things for these people. And it's not a one and done. You can fill this out as often as you want. And once you get your tailored resources, you'll get an email with the resources and you get to send them to your families or send them out to neighbors or Girl Scout troops or whoever you're working with. We also have built into this area, how do you communicate? Remember the health professionals said, oh, I'd do it if I knew how to do it. Okay, well, we're going to bring forward the best science on how to have these conversations. And so we have a summary of what is the best science for communicating with your patients. But as a nurse, I want to tell you, the reason we're number one, 23 years in a row, is because we listen deeply, we try to find common ground, we stick to the science, and we focus on safety all the time. You do this, and I'll meet you at the Gallup poll results next year. The gateway link is here. It's an active QR code. Please sign on because I want you to start pushing this out. We've done the groundwork to lay this brand new tool and are very, very excited about it, but it is not going anywhere unless you folks make it a standard part of our usage. Have little iPads in your waiting rooms in the health clinics that people can log on and ask questions and find resources. Make sure that you're bringing it to every group you're a member of, every board you're a part of. Bring it and embed it in every classroom that you teach. We are on the move, folks. We need accurate information, and NASM is making sure it's in our hot hands. Thank you very much.
Okay, were those amazing presentations or what? I think the richness and the diversity of our presenters today is absolutely amazing. You know, what, let's give them one more hand. That was a lot of work to get up and describe their work. Thank you. All right, so now we are going to shift gears a little bit. We're going to move into a Q&A, and we have about 15 minutes left. So I heard a lot of really interesting things when you all were presenting, and I learned some stuff that I didn't know. I learned some fascinating stuff about data that's disappearing. We heard about our up and coming generation and some of their interests and what they think about climate change. I learned some stuff I did not know about healthcare workers and what they think about climate change and their patients' perception. And I was also really interested in some of the gaps in research that have been identified. So if we kind of circle back around to one of the original themes of this panel, we've now heard from each of you individually about the work that you and your teams are doing. I want to kind of focus a little bit on collaboration across disciplines. And so, and by the way, any collaboration across disciplines that further conserves precious resources is even better. And so I'm wondering, and I think we'll just go down the line, but we'll kind of reverse the order this time. If any of you have some easy wins or best practices or experiences with collaboration across disciplines that you can sort of send out to the audience as an idea or a best practice, something that they can take home with them. Teddy, why don't you start?
Great, thank you. I am by background a planetary health nurse. I support and look at planetary health, which is by definition transdisciplinary research and transdisciplinary practice. So it is the way I'm wired and the way I think. I think an example most recently is in North Minneapolis, which is a underserved area, underrepresented as far as economics, and live right along the interstate corridor. There's a lot of heavy industry up there, and their asthma rates are through the roof. So a group that I'm working with right now is involves extension services, our faculty who are atmospheric scientists, myself as a nurse, and people from North Minneapolis, both in community leadership and a very vibrant church up in North Minneapolis. And I love this project. We have a mobile unit that is going around collecting air quality measurements and data. So that we will be able to show up in front of the legislature and say what's happening, being disproportionately in this neighborhood. And then the other arm of the project is we're teaching the kids to be citizen scientists, and they are just jazzed. We're teaching them, this is the information we need. This is how we collect it. This is how you're involved in determining where our sensors are going to go. You're involved in analyzing the data. And this data is going to help improve the health of your grandparents and your siblings that are struggling. So that's a wonderful example that we're very happy about.
I love it. As somebody who practices in Northern California, I frequently work with asthmatics, and I work in an area where we have sort of the combined impacts, really poor air pollution or really bad air pollution, and then the occasional wildfire smoke. I've lived and worked through a lot of wildfires. So you're preaching to the choir there when you talk about understanding just how air quality impacts health and asthma. Jonathan, any best practices or easy wins?
Yeah, I'll continue the air quality theme. So this is, I mean, the public health imperative for working to mitigate climate mitigate emissions and work to address our environmental harms is probably pretty obvious for those of us in this room. But I meet folks all the time who don't really see the connection between public health and climate. And I think that the tools for communicators and just hammering on this message is very worthwhile. And I'll pull on some of the threads that Ali brought up in the fireside chat. So data centers are the hot topic right now, and air pollution has emerged. It seems to me to be a really effective wedge to understand the impacts of data centers on communities. And I'll quickly say two projects that I worked on. So last year, I worked on data center water policy in the state of Utah with the Aspen Policy Academy. And in the Great Salt Lake Basin, the basin is facing a water crisis. And there's arsenic in the bottom of the lake bed of the Great Salt Lake. And as the lake level drops, that arsenic can go airborne. It's been called an environmental nuclear bomb. And data centers are absolutely flocking to Utah because Utah is business friendly and is trying to attract them. And water is really cheap, despite the fact that there's not a whole lot of it. And so elevating the public health risks and the air quality risks of additional water consumption in this basin, which is a terminal basin, really motivated the lawmakers we were talking with when we were pitching some best practices for data center water policy. And then the second one I'll talk about really quick. I used to work until 3 weeks ago full-time at the Harvard School of Public Health in a lab primarily looking at air pollution with Dr. Francesca Dominici. And we worked with the Southern Environmental Law Center and did a health impacts report on a proposed 3 gigawatt data center campus in Pittsylvania County in Virginia. This was a 3 gigawatt natural gas plant and data center that was proposed. And we did a health impacts report and found that the air pollution from the plant would lead to $640 million of cumulative health impacts by 2040. And we laid out the risks to public health of residents of the county and Virginia and North Carolina. The company had been really, development company had been really blasé about this and put out a press release saying the emissions from the plant will be the equivalent of standing by your barbecue on the 4th of July, and just they obfuscated to the best of their ability the impacts on residents. And so we published this report, and the company ended up pulling their proposal. And that same day, we published the report. 24 hours later, they pulled the proposal, and that same day, the city council went on to vote on the proposal and unanimously denied it. And so, that air pollution dimension, which isn't often connected with data center build out, was incredibly useful to bring into the conversation.
So interesting. Yeah, I feel like as a healthcare worker, I'm absolutely deluged with things about AI lately, right? You just cannot escape the discussion about AI and its impacts on healthcare and health. And I think it's so important that we have data scientists like you who can sort of introduce a nuanced and thoughtful discussion about the many, many sides of the elephant, if you will, that AI involves, that it's not just about the information and the integration AI will bring us, but that there is this entirely other aspect. So thank you for doing the work you do. Ying, can you give us any stories?
Yeah. So for our group, we had cross-disciplinary collaboration in terms of type of research, from laboratory to clinical trials, community, computational policy research. And we had cross disciplines in terms of people who are mainly scientists and people who are mainly policy. And then we also had this geographic dimension of binational collaboration. And so the takeaway for me was that all the participants recognized that everyone had something to offer. And for example, there has been maybe more work done in laboratory research where there are more ways to procure sustainably. And so how would we apply what they've learned into clinical trials research, for example? And then we saw really some leading practices in the UK that we would love to see possible in the US. And so I think where you can highlight the, or bring together members that recognize or highlight the recognition so that everyone does recognize what everyone can share and bring to the table, that really helped make our collaboration successful.
Absolutely. I love the idea of breaking down the silos in an area where we are seeing so much polarization, getting the data scientists and the scientists together with the policymakers and eliminating some of the polarization and the barriers that often stand between them. Renee.
We're polarized? I'm just kidding. I know.
I'm just going to let that one go.
Yeah. Well, I bring it up because, I mean, my first comment was going to say that I love this question because it gets at, again, to beat that drum of radical collaboration. And we think about, you've heard all of the linkages, right, that are being made in this discussion. And the fact that we, by making these linkages, we not only create better science, but also make sure that that science doesn't sit on a shelf, but it's immediately informing those real world problems. And we're telling that story in real time. And that can actually rebuild the social fabric of our communities and of our country, right? As we start to not only reach out to each other in this room, but also reaching out and telling those stories of how science and data is actually leading to improved health and well-being. So if you need inspiration, this is where I go to it. So Collective Impact, they have a collection of multiple different entities that have really utilized collective action to achieve things that no one organization could possibly achieve alone, and which tackled these super complex challenges. I mean, I think climate change is ultimately the epitome of that. And we're able to tackle multiple facets of it. And so Collective Impact, as they looked at these different initiatives and ways that people work together, they actually identified 5 things that I want to highlight. First, there was that backbone and that coordinating organization. We oftentimes have relied on the federal government to serve that role, and we need to continue to advocate for a move towards that, but we can't wait on them. And we have to start building this new infrastructure with which to lean into how can we do this ourselves. And second is there's a common agenda for change, right? They find those common denominators. Third is that there's a shared measurement for data and results, right? We're measuring apples to apples. Each organization is defining and working towards that same data goal. The fourth is that there's mutually reinforcing activities, right? Everyone holds a different piece of the puzzle, it's touching a different piece of the elephant. And so when you connect all of those, you can actually line these up and make sure you're passing the baton, right, to that next person, to that next organization, so we can seamlessly move at the speed and scale that we have to. And then, of course, open and continuous communication is the last one. And you need that infrastructure with which to do it. And so there's too many to count that have utilized Collective Impact in powerful ways, but just seriously, look at that. If you need some inspiration, look at what they've done. We can do that and then some.
Love it. What I love about Renee's comments too is they infuse us with some hope. I would add that Paradise Built in Hell is one of my favorite books ever. It kind of got me through the pandemic, to be honest. So that is a wonderful way to end the last 4 minutes of our panel. I do like to end on hope. So what I want to do is we'll start with Renee and once again move down our panel. I want to ask each of you, what brings you hope?
Well, that's an easy one. All of you in this room. I mean, what brings me the most hope is the colleagues that I connect with day in and day out. I may not have seen you or worked with you in a year or 2 years, but I know when I see you, I'm like, you are moving a piece of this puzzle forward. How is it going? And we are all there collectively together. So it's all of you.
I had the honor of working with the next generation of leaders. And so that certainly brings me hope. But I will also say, like, learning from current leaders and the current generation, it's been very hopeful as well.
Community as well. I mean, I am so buoyed by the amount of people who come out for Climate Week when we're facing such difficult headwinds, and the amount of you in this room working on climate and health, and the fact that in the face of such difficulty, we're working to push forward.
I'm going to cheat and say 2 things. One is I want to say the NASM staff. Holy cow, that's an amazing group of talented young people and incredibly hard workers. And I couldn't be more pleased to know them, and they give me a lot of hope. I've been in this work a long time, since the late 1990s, early 2000s, and I was a little bit like Chicken Little running around saying the sky was falling. People are like, oh, here comes Teddy. She's going to talk about climate change. And so what gives me hope is people are finally saying, oh my gosh, what do we do? I find that as an incredible opportunity because we have receptive ears and receptive hearts. So this is our moment, folks. We are the trusted voices, and that gives me a lot of hope.
Thank you. And I am going to cheat and take a page out of Teddy's manual, and I am going to say what gives me hope is what they said. So with that, I'm going to give you 2 minutes back of your time. We're going to conclude this panel. Thank you so much for being here today. It is just an honor and a privilege and also inspirational, a very hopeful thing to be here. Thank you.